let's talk about a topic that touches the lives of so many of our patients, their families, and even some of our colleagues: dementia. Now, when we say dementia, we're not just talking about forgetting where you put your keys or mixing up someone's name once in a while. We're talking about a progressive, degenerative condition that slowly chips away at a person's memory, thinking, judgment, personality, and ability to function. It's a major diagnosis, and it is not a normal part of aging. Let's start with the basics. Dementia is not a disease. It's a syndrome, meaning it's a set of symptoms that result from a variety of diseases. The most common cause? Alzheimer's disease, which alone, or in combination with other disorders, accounts for up to 75% of dementia cases in older adults. But that's not the only type. We also have vascular dementia, Lewy body dementia, frontotemporal dementia, and others that result from infections, trauma, toxins, or psychiatric conditions. So when you see a patient with memory loss, don't just assume it's Alzheimer's. You've got to think like a detective. What else could be going on? Now here's the tricky part. Dementia usually creeps in slowly. At first, the symptoms may be subtle. Someone might get lost in their own neighborhood, miss appointments, or ask the same question over and over. But over time, things progress. They might struggle to manage medications, finances, or meals. Eventually, they may not recognize their loved ones or remember how to brush their teeth. What's happening in the brain? Neurodegeneration. Brain cells are literally dying off. The damage is progressive and in most cases, irreversible. And it doesn't just affect memory, it affects reasoning, language, movement, and mood. But here's something every nurse needs to keep in their pocket. Some conditions can mimic dementia, and they're treatable. We call this reversible dementia or pseudodementia. Causes might include severe depression, vitamin B12 deficiency, hypothyroidism, medication side effects, brain tumors, normal pressure hydrocephalus. So your assessment matters. Lab work, imaging, mental status screening. All of it matters. Don't label someone with dementia until reversible causes are ruled out. Now let's talk about what this means in practice. Step 1, know their baseline. If you don't know what the patient was like a week or a month ago, you won't know if today's behavior is new or old. Are they confused all the time, or is this a change? Baseline matters. Step 2, safety. Dementia patients are at higher risk for falls, medication errors, wandering, malnutrition, and even abuse. They need structure, routine, and environmental cues, like clocks, calendars, photos, signs, and familiar voices. Small things make a big difference. Step 3, support the caregivers. This journey is exhausting for families. They may feel isolated, frustrated, or guilty. Our job is to educate, support, and connect them to resources. Encourage them to take breaks, to plan ahead, and to ask for help. Now I want to leave you with this. Not every memory loss is dementia, and not every dementia is permanent. But when the diagnosis is made, your care, your voice, your presence can mean the world to that patient and their family. So let's be the kind of nurse who sees the person behind the confusion, who speaks gently even when they don't understand us, and who walks beside families on this long, hard path with compassion and knowledge.